So I'm joined by Kathryn Vickery, who is a chiropractor, and she's going to be telling us a little bit more about what she does, her experience with the MLS laser, and some of the results that she's had from that. Thank you so much, Kathryn. I keep wanting to call you Kath. Kathryn, for joining me today and for being willing to have a chat with me. So if you can just tell us a little bit more about who you are and what you do.
Yeah, sure. Hi, my name is Kathryn Vickery. My main occupation now is working as a McTimoney chiropractor. I've been doing that for about 19 years now. Previous to that, I trained as a medical herbalist. So I was working with plant medicine and nutrition and naturopathy, vitamins, that kind of thing, to help people feel well. And then I qualified as a McTimoney chiropractor. I've been doing that since. I love the bodywork side of it. And I love that McTimoney chiropractic, again, when we link this in with laser, it's very much about helping the person's body to heal itself. Yeah. So that's what we're doing with chiropractic, and that's what I was doing with herbal medicine and nutrition. So the laser felt like another step on that same pathway.
Yeah, yeah. Perfect. I like that. It's can we always say it's not the laser that does the fixing, it's the body. Yeah. The laser just kind of gives it a wee nudge and tells it what to do.
Exactly. Yeah. Exactly. Yeah.
So in your clinic, Kathryn, what types of conditions are you seeing, regularly that you're using the laser for?
Yeah, well, with chiropractic, it's musculoskeletal stuff. So again, that was the other reason why I wanted to look at laser. Was actually a colleague of mine, Steve Rule. He'd been telling me for about 7 years, have you looked at the MLS? No, Steve, I haven't. And we were having this conversation quite a lot. And his wife, Julie Rule, she and I had a conversation about it too. And then I was getting fed up in clinic with all the inflammatory conditions that I was seeing, and the numbers of people needing to take opioids and naproxen on a regular basis, and then all the other drugs to support them with the side effects of those. And I was feeling quite frustrated as a chiropractor in that sense. So having had another conversation with Steve and Julie, I thought, well, I better have a look. I better have a proper look at the laser and see if it is going to. And so, to cut a long story short, I had one of the trial periods with it, and then started using it on certain inflammatory conditions, like Achilles tendinopathy, rotator cuff injury, adhesive capsulitis, that kind of thing, arthritis in the knees and the hands and the elbows, because I do see quite a lot of that. And then when I actually, because I haven't been using it very long, so I've actually only had one of my own since January. Yeah. And since then, I have been using it on a very regular basis, but I'm absolutely astonished at how quickly things have turned around in the clinic, in the sense that there are so many other conditions that I can say, yes, let's have a go, I can try and help you with that. Yeah. Whereas before I would just say, well, you need to strap it, you need to exercise, you need to rest. Yeah. So that's been the real difference, is that I can actually say, we've got something here that we can try and work with your pain with that.
Yeah, excellent. It's a good feeling when you've got something to offer somebody. For me as a podiatrist, those were the arthritic patients, when you were able to tell someone that it was, without having had x-rays and things done, but you were fairly sure that it was a diagnosis of osteoarthritis. Exactly. And you are kind of limited with what you can do with that before you're referring the patients for, drugs or steroid injections or whatever is appropriate for that patient. And it's just really nice to have something non-invasive that's safe, that patients are, they're keen to try it. So I completely understand from where you're coming from with that. Yeah. So do you have any particular cases that you'd be willing to share? Anything that's put a smile on your face and your patient's face?
Well, last week I had a huge smile on my face on Friday because I've been treating a woman, a female, 79-year-old female, who contacted me about 4 or 5 weeks ago regarding pain due to 2-3 osteoporotic non-traumatic spinal fractures. She'd been in constant pain since August last year. And a friend of hers had been having some MLS laser with me for her knee pain. I'd helped her, so she had then told her friend, and her friend contacted me. She's got quite a lot of autoimmune conditions as well. So she's got chronic kidney disease. She's also got the fibrotic lung condition, fibrotic non-specific idiopathic pneumonia. Sorry, it's quite a mouthful, that one.
It's like a foreign language.
That one, yeah, it's a long one. So she's on a lot of medication, and I was concerned that the laser would be contraindicated with her medication. So I contacted yourself, and you said, no, absolutely fine on those meds. So I told her we could try, and she wanted to try. So she came. I wasn't sure whether it would actually be able to help with the bone pain, because she actually had quite a lot of tenderness. She also struggled to be touched, so her pain threshold her nerves were very agitated. Mm-hmm. So I could only just place my hands on her back to gently feel over the skin, over the area. And she's also been on steroids for 5 years, so to help her lungs and to help her breathe. Yeah. So what I actually decided was I would use the scan setting contusion I went for. Yeah. And I also worked, so she had quite a lot of muscle trigger points in serratus anterior, the rhomboids, levator scapula, those areas. So I did contusion and trigger points in those areas, and actually over her spine. And she was laying prone, and on our McTimoney chiropractic bench, as you can see in the back there, you lie on your front with your arms on some handle rests, so that pulls the scapula nicely away. Mm-hmm. And then at the last, so this is why a smile came up on my face on Friday, not just because of the pain, but because she also sat there and she said, my resting oxygen sats have gone from between 92 and 94% to 95, 97, 98%.
Okay, amazing.
And she said, is this placebo? I said, no, placebo wouldn't have that effect. I don't think it would have that effect. Mm. Well, it wouldn't, as I understand it, placebo will only last 2 or 3 days after a treatment. So I said, I don't believe it is placebo. And also I'm just only radiating over the left-hand side, because that's where all of her muscle function and pain was. So we'd only actually done the top of one lung. Okay. And the condition she has generally affects the lower lobes. Mm-hmm. So she's having a week off now, and then next week she's coming to start 4 weeks of working on the lungs. And what else? Other things haven't been as dramatic as that. They've been a bit slower. So working with the hip pain syndrome, that tends to be a bit slower, but pain does improve. But it's not as overnight, I don't think, with that one.
Yeah, no, that's good. And I think, so I spoke to somebody else this morning along a similar vein, and she said exactly that. Some conditions respond, and some patients respond really quickly, whereas others take a bit longer. And again, what I said to her, I'll repeat it here, it's just a nod to the fact that everybody is an individual, and everybody is the sum of one, and they just respond in their own ways. And sometimes you do get these dramatic responses, and it's like, is that a laser or is that a magic wand? And other times it does just take a bit longer. Either way, it's okay, as long as you're seeing those improvements in some way, shape or form, then that's kind of what we're aiming for. Yeah, exactly. So all good. So based on, I know that we're middle of March now, and you've just really had your own laser since the start of January. So based on your experience in these kind of few short months, would you, as a chiropractor, recommend MLS laser to other chiropractors, other clinicians?
I would if you want to spend, because it does take a lot of time.
Yeah.
So a treatment session ends up being up to 45 minutes.
Okay.
And I know as McTimoney's, we usually have about 20 minutes, half an hour for a session. So if you're happy to put that time into a treatment, then yes.
Yeah.
And if you want to spend time working on exercises with people, giving them that kind of advice, as well as using the laser, because you need to do that too. So if you want to bring those things into your clinic and work in that way, then absolutely, I would say go for it.
Yeah, it's kind of laser as part of your treatment program. So it's not just a standalone, you use it alongside all your other kind of, traditional management methods, other things you put in place, you still do that. And you just put the laser in there to help increase the speed of healing, to get them better, faster.
Exactly. And to improve the scope of things that you can work with.
Yes, as you mentioned earlier. Really important point.
Exactly. So that's the bit that got me quite excited.
Good. I like it when people get excited about their laser. And I know this is a tricky one, but I will point out I did send these questions over in advance to Kathryn so she could have a chance to think about it. So can you choose 3 words that you would use to describe the MLS laser?
Well, I just thought it just for me, it's a great healing technology.
Fabulous.
That's it for me.
That's perfect. That's all we need. That is brilliant, Kathryn. Thank you so much for your time and sharing your experience and your lovely case study as well. That's brilliant. Thank you so much.
You're welcome. Bye-bye. Have a great day.
Bye.
Bye. Bye.